I don't want anybody to be laughing. I'm a nursery student about all what you are saying. These people have implemented, these have done this. Wherever I have talked to, this electronic health records and all is very time consuming, it's very expensive to initiate. As a solo ophthalmologist by myself, I don't have much to share with much people. What should I do? I don't have any system yet. I'm looking at it. But anytime you look at it, there is disincentive. Oh, there is incentive from government to pay over so many years. But up front, I have to come up with that money to implement it, to buy the program.
So CMS is up here, so they can answer the rules, the details of the rules. We're going to bring up 6 physicians here in a little while on a panel who have all gone through this process that you're asking, how do I do it? This would be a great question to ask that panel because each one of them has a different approach to it. So could I get you to hold that question until the panel comes up and ask it of your peers? All right, thank you.
I just wanted to comment about the previous gentleman's question about how you exchange information between different entities in the metropolitan regional area. There is a regional health information exchange being formed. It's eHealth Align. It's out of the Mid-America Regional Council office. They have an exchange software that they're working on, and they're working right now with hospitals to get them signed up. So that's the way, through that health information exchange software or through LACI, some other HIO, that will happen.
I wanted actually to ask or answer this gentleman's question down here. He was wondering about certified e-prescribing products. If you go to surescripts.com/certified, their SureScripts hub is the certified body for e-prescribing, and that is where you can actually go and.
That's for the incentive.
For that, that's for the e-prescribing.
That's for the incentive part.
Right.
That isn't for the payment adjustment part.
No, but somebody had asked about determining the certified products. What was a certified product?
There are listed on CMS ones that are certified for the incentive. There aren't any listed to avoid the payment adjustment. And it's noted.
Wouldn't those be the same thing?
No, well, you would think so. But they specifically note that all of those that are approved for the incentive have not been approved or qualified for the payment adjustment. And then she said you had to read the paragraph and figure that out. And they're not going to have that by the end of June.
This is kind of a two-part question. If we do the reporting on ERX, what is the incentive we get if we do it before June? And then my second question is for the EHR. You have to register by a certain point. You said register now. If we're not using it now, doesn't the clock start ticking once we register? And you know that the $18,000 or whatever it is that we get, we register now. Wouldn't it be better if nobody's up on it to register in 2012 to get that?
For the e-prescribing, if you start now and you report at least 10 events, you're going to avoid that 2012 payment adjustment. That's the real, it's not an incentive. Well, it is an incentive to start now by June 30th. The incentive payment for, again, doing the electronic prescribing, at least 25 events during the calendar year, by December 31st, you will also get an actual payment incentive that is 1% of your 1% of allowed charges from the physician fee schedule.
So it's two separate things. 10 in order to avoid the penalty
Yes.
or the adjustment, but you need to do 25 by the end of the year to get the bonus.
Yes.
Okay. But what if you do 25 after June? Do you still qualify for that bonus? But still get the penalty?
Exactly.
Correct?
Exactly.
However, you would avoid the penalty in 2013.
Right.
What they haven't said is you have to do the 10 in the first 6 months to avoid the adjustment in 2012.
Right.
However, if you don't do at least 25 by the end of the year, you will then have a 1.5% downward adjustment in 2013.
Yes, he's correct.
That's on the book, so there's really more than one thing you have to do in 2011.
Okay, and the last part of your question regarding registering for the EHR incentive program. You don't even have to have electronic health records to register. There's really no downside to registering. You're simply going into the system, putting in all the identifying information so we know that there's nothing wrong with your provider record. You have to be enrolled in the Medicare provider enrollment system. You have to have your national provider identifier. You have to know the tax ID number you want your incentive sent to. But let's say you registered this year, and then as October came ticking along, you went, oh, we're not going to meet 90 days of demonstrating meaningful use. We're not going to participate until 2012. That's okay. There's no clock is ticking because you registered. We only look at, and people kind of get confused over, it's two separate things. The payment period is the calendar year. The first year of participation is 90 days of demonstrating meaningful use. So if through, October through December, okay, we made it, we had our 90-day period, we're still looking at all of your allowed charges for the whole calendar year to determine what's your incentive payment going to be. So even though you didn't meet meaningful use till October, we're looking at your January claims. Let's say you're somebody who doesn't immediately hit the 24,000. You have a low Medicare patient volume or whatever. We're going to look at claims for the entire year when we figure your payment. And you've got until October to have the 90-day period. You've got until the end of February to actually register and attest that, by golly, here's all the information we need to prove that we demonstrated meaningful use October through December.
So all my paper charts that I did January through October for Medicare people, my incentive will be based on those, even if I don't start my EHR until October.
Your incentive payment isn't based on your charts. It's based on your allowed charges for services that are paid through the Medicare physician fee schedule.
Right.
Okay.
So everybody I saw that was Medicare, even though I didn't do it on EHR January, February, March, all the way through October, my payment will be based on those, even though they weren't on EHR.
Yes.
As long as I meet meaningful use for 90 days.
Yes, you meet meaningful use for 90 days. We pay you based on all of your Medicare allowed charges up to the annual maximum for the entire year.